Hi, I'm Dr. Asghar Husain. Shoulder instability is a problem that I sometimes see. What does it mean? Well, it means the shoulder's not stable, which usually happens when the ball comes out of the socket. So very often someone will present to me and they'll say, hey, I was riding my dirt bike, or I was playing hockey, or I was playing soccer and I fell down with my arm out, I dislocated my shoulder, I went to the ER, they put it back in, and then the question is, well, what's next? In order to understand where to go from here, we need to take a second and understand shoulder anatomy.
Okay, all right, wait, hold on now.
Yes.
So two questions. First of all, what is the most common way that people dislocate their shoulder? Is there like one specific thing that just does it?
It's often a fall. It's all over the map.
Yeah, but is there a specific like movement or fall? What is it?
If it comes out the front, because you can come out the front, you can come out the back, that's oversimplifying things. But if it's out the front, most of the time the arm has to go out and back.
Okay.
We call that abducted and externally rotated.
So it goes out and back and then you fall back on it?
Well, you can have another player. For example, I've seen in basketball, someone grabs your arm and starts to pull. I've seen it come out that way. Very often you can fall and the arm can go out. In football, your arm can go up, and if someone lands on you, the arm actually goes back.
Oh, wow.
And so it gets quite violent. And there are many ways to hurt yourself, sadly.
Okay. The other thing is, I'm watching this, I'm wondering, what's up with the music? It's kind of tragic, it's kind of sad, kind of uplifting. I feel like I'm watching Brian's song or something.
Yeah. Well, let me put it this way. My role is the content. And the creative embellishments, the production, and that stuff is in the hands of someone else. My general sense is music has no place here. And the titling, I'm not a fan of that titling either.
Yeah.
I'm generally not a fan of that for any kind of professional videos, unless you're just trying to make a very specific point that should be repeated. But I'm generally not a fan of titling, and I'm not a fan of music because, at least for me, it's very distracting.
Yeah, it is. And the thing is with the titling too, I don't know if you notice this on YouTube videos, but 90% of the time, the spelling is wrong, or the grammar is wrong,
right,
or they have the wrong word.
That's right.
Because it's all automatically done.
So it just gets confused.
Yeah, it gets confusing.
And I think when you're looking at a ticker on a news channel, it makes sense because it literally is machine learning trying to do that. But if you are putting together something that's produced, I mean, generally I think it doesn't have a role. So I would say that part is not within my creative scope in this specific video. This was done.
All right, that's all right. You don't have to accept responsibility for that.
It's done as a part of a series of videos for my group, but it's not fully within my creative control other than just the content.
All right, that's okay. But meanwhile, I'm going to grab a box of tissues.
The shoulder is a ball in a very shallow socket. And what holds it together, especially because we're talking about shoulder instability, are ligaments. And ligaments are thick sheets that wrap around the shoulder, and they connect at the socket with a structure called the labrum, which is like a little speed bump. And when you dislocate the shoulder, 90% of the time, you will actually rip the ligaments off. And the problem is when the ball comes back in the socket, those ligaments stayed torn, and the labrum stays torn.
So wait, you're saying the ligament never heals?
Correct. Well, there's a distinction. When you injure something, the body will automatically engage the healing response. That means it's going to make it just get stuck wherever it is. So for example, if this is a socket and the ligaments that attach there go here, and if the ball comes out, the ligaments are over here. So it will technically heal over here.
But it won't reattach to where it's supposed to reattach.
It won't move its way back. So the distinction is really we need, in order for it to have some value in protecting the ball from coming forward, it needs to heal to the very front part of the shoulder in the right spot, which usually doesn't happen.
So basically the shoulder is just loose, has no tension on it.
It's not necessarily that it's loose. It doesn't always impact the quality of life or the performance. That's a whole other topic. I think I'm very briefly covering it in this video. It's a whole other topic about what is the relevance of the position of that ligament in terms of it coming out again.
Okay, cool. Let's move on.
When someone sees me for the first time, the first option really is, well, if we can train the muscles around the shoulder to stabilize the arm with a physical therapy program, depending upon what sport or activity that person wants to get back to, that may take care of it. But someone who's younger and who is involved in an active sport or a contact sport has about an 80 to 90% chance of coming out again. And very often when someone has seen me, they have 5, 6, 10, 20 dislocations. Now, here's what happens when you dislocate a lot. Okay.
Seriously, they can have 20 dislocations?
Yeah. Sometimes I've heard more.
How does that, okay, I'm just thinking, I've never had a dislocated shoulder.
Yeah.
So I'm wondering, which is the most painful? The first one?
Yeah, most likely, correct.
Okay, so the first one's the most painful. If you're at the 20th one at this point, how much less pain is that than the first one?
It's usually less, but sometimes it can be very traumatic. Because what typically happens is someone dislocates one time and they let their life go by. They dislocate another time and they let their life go by. And sometimes they don't even see anyone for a while for whatever the reasons are. And then ultimately starts to come out in their sleep. And it starts to come out so many times that they finally, somebody, either themselves or someone in their world says, hey, you need to go get that checked out. And often by the time they present to an orthopedic surgeon, they have ground down the socket a bit, or they've ground down the back of the ball, or they've worn out the tissues.
But does this thing like literally pop out and you have to pop it back in, or does this go back in on its own?
There's not really one way, but I would say generally speaking, in people who have normally tight ligaments, you usually have to do an anesthetic to put it back in. But when it comes out enough times, when you've damaged the tissues that much, it can often come out on their own. And there are a subset of people who naturally have very, very loose ligaments that often will come out even with very little trauma or nothing, sometimes just reaching out and grabbing something.
Yeah, I'm just wondering, like, who's this person that waits 20 times to have their shoulder dislocated, go get it checked out?
It's more than you think.
Oh my God. All right.
Whereas the first dislocation, you'll often just tear the ligaments and the attachment. The second, third, and fourth, if you look at the model, the ball is pinching up against the socket. When the ball pinches up against the socket, then what's happening now is you're creating a bone injury to the back of the ball and to the front of the socket. And so what happens over time is you lose the surface area of the socket. So you literally can see an area where the socket is actually worn down in the front and the ball is worn down in the back. So when we're designing a surgical plan, which often will happen when someone has come out many times and they're coming out again and again and again, and it's disrupting their lifestyle, is what we need to ask is, how do we reduce the risk? Because if someone's coming out again and again, that risk is 100%. The surgical techniques we have nowadays can bring that to around 5%, which is really, really good. So we're not getting into zero, but we can generally reduce risk and get that a lot lower. It also depends on the sport. Someone who wrestles and plays hockey or does any kind of a combat sport is going to still be at a higher risk, and their risk even after surgery may be higher than 5%. With that said, when someone is ready for an operation, we will consider what we need to fix. And so there are some situations we can arthroscopically put a camera in the shoulder and we can reattach the ligament and the labrum at the very front of the shoulder. And in those situations, we will stabilize it with little tiny anchors around the socket. And that person now has about a 4 to 6 month plus recovery process to try to gradually get back to their activities. However, as I mentioned, sometimes there is bone loss, either in the front of the socket or the back of the ball. In those cases, we'll sometimes even do a surgery where we now have to add bone, represented by my finger here, where the bone is now increasing the surface area of the socket so that the ball has more room to travel. There are also situations where we will take the tissue in the back of the ball and we will sew that in there. That will help to keep the ball from coming forward, and that is called a remplissage. So there are some situations where we will change the amount of shifting forward that happens by sewing and tightening up muscles in the back. Generally speaking, the recovery from those procedures, which sometimes can be arthroscopic, sometimes they're open, we can use bone from the person, like this bone here called the coracoid, and we do a procedure called the Latarjet, where we can bring that and we can lay it down on top of the socket and we can fix that.
So wait a minute. So you take that bone, that little horn thing, and you cut it off?
Yep.
And then do what with it?
Yep, and we flip it around and we're using that to increase the surface area of the socket. So the context of that will be somebody who, if you consider the socket looks a little bit like a shape of a pear if you slice it down the middle. And so basically it's wider at the bottom. And ultimately, if you lose some of that, then what you are doing is recreating some bone so the ball has some surface area in which to glide on.
Right. So if you cut off that bone, there's no, like, what is the point of that bone if you can just cut it off? Is that needed for anything else?
There are muscles that attach to it, you know,
Right.
but like many things in surgery, when you take something from one spot, there are complications that can arise from it. So none of these things are perfectly benign, but ultimately you're utilizing for a specific purpose. When you use bone from yourself, you are able to get quite robust healing there. But like any surgery, there are pros and cons of each choice, and it's certainly not a perfectly benign choice, but it's an option that we have.
So that bone does do something. It has something attaches to it, a muscle
Correct.
attaches. Okay.
Correct.
So then if that muscle can't attach to it anymore, that's a whole different.
Those are not critical muscles for functioning. Usually there are other muscles that are much more important for functioning in that area.
Okay. So it's a trade-off, basically.
Correct.
Okay. All right. That's actually kind of amazing.
And sometimes we will use bone from a dead person to try to extend the surface area of the socket, and we can fix it that way as well. And all these procedures have, generally speaking, good results, and they all have their pros and cons. Ultimately, the recovery process will still be in the 4 to 6 to sometimes up to 12 months, depending on the surgery and depending on the sport someone wants to get back to. But where this is all pointing to is when someone can go through a rehabilitation program that will be focused on getting your movement first, getting your strength second, and then working on the performance metrics, what someone has to do for their sport, whether it's an overhead athlete who needs to be able to throw or someone who needs to get some strength and various sport-specific activities, we can then have them go back to their lives.
Okay, so my takeaway from this is, guys, do not wait till your shoulder dislocates 20 times and your bone is worn down to do something about it.
Yeah.
It's back to being responsible for your own health.
Yeah.
That's kind of absurd.
Yeah, it might be a man thing, you know? We grunt our way through our lives sometimes.
The second thing is I'm feeling kind of emotional. I don't know what to feel right now because I feel kind of, it's a tender moment and a little bit sad, but uplifted. I think it's that music.
The piano music?
It's the music,
yeah. Okay, there you go.
And third, I think the reason they have the text on there is because you are actually showing this in the lobby of your office. So if you're showing this in the lobby, the volume is almost always down.
Yeah.
And then people need to follow what's going on by looking at the screen.
Yeah, but sometimes the text is not right. So.
Yeah, but I can see why they did it. It just occurred to me. This is in the lobby, so that makes complete sense.
Yeah, you're probably right.
And number 4, I feel like reaching in there and grabbing your tie and straightening it.
Yeah.